think we're going to start with Secretary Dooley. So you've had a chance to look at this data and listen to Mark's presentation. Why don't you tell us what jumps out at you?
Great, thank you, Daniel, and thank you, Mark. And I really appreciate the longevity of this project. When we first met a few years ago and started looking at this and looking at 2014 and the opportunity to test the shifts in people's opinion, I think what I'm first struck with is that there's rarely the kind of laboratory that this represents, and particularly the timing of this collection of data in the summer before we have started our public outreach through Covered California. The baseline that this represents for us to refine over the next few years is really extraordinary. And I think that it makes me quite confident that the work that the staff at Covered California is doing with its focus groups and outreach and polling information fits very neatly in the public data that you have provided. So I think that we're on the right track in the plans that we have. And I know even 2 years ago when we started meeting at Covered California, there was a lot of eagerness among those of us that have advocated for this kind of opportunity to make Californians' lives better. That eagerness has been there, and there's been a lot of anxiety from the sense of being anxious that we're not out there with the message yet. And I think there's some of that that's reflected in this, in these data. But I also think that it's sort of like going to a dance. You know, you don't want everybody there until you start the music. And when you are marketing to a population and you want them to take an action, you want to be able to have them take that action. And that really won't start until this fall. We do have a robust website that's up now. We're getting a lot of visits. We have calculators on the site so that people can begin to look at, put their own information in and begin to determine what will be available to them. We are building on the fly. We're doing a lot of things concurrently as we get ready for this launch, and it's going to roll out over the fall and into the next year. The other thing I'm struck with is the amount of time. I'm really sort of overwhelmed that 73% want to sign up tomorrow. We can't enroll 73% of the people on day one. There isn't going to be a switch that is flipped and everybody is going to automatically enroll. Actually, with a pretty significant exception, the counties have worked on a low-income health program, the Bridge to Reform, to bring people at the county level with the federal participation. So we've got over 600,000 people that will be eligible primarily for Medi-Cal on January 1. Some will go into the exchange, but there really will be a flip of the switch for those people, and we have a transition plan, so they will come immediately into the program. But I think one of the highest level responses that I have to this, and I've seen it throughout, and in the work that we're doing with our colleagues in other parts of the country as we're moving to implement the Affordable Care Act, is the consistency of the partisan divide on the subject. And how that has worked to our advantage in having the framework in California to move forward as we have, because we have that political support. But I think it also creates the opportunity for us to show that once we are distributing messages and product, when people are actually responding to the facts and not the mythology of this, we will see whether political ideology trumps personal interest. Because a lot of the people who think that what they know about the act is negative, will they be able to overcome that to take advantage of it for themselves and for their families? And I think they will. I think also I'm struck by again, the sophistication of the work the staff at the Covered California is doing in the structure of our outreach efforts. It's in three primary categories, all related to what is affirmed for me in your data about getting information from trusted sources. Our outreach plan, much of it is through community-based organizations, through training and messaging of the people that are in those communities of color and poverty that have relationships with other providers of service to that population, and giving those people the tools and the information to reach out. The second part of our outreach is through enrollment counselors. And there'll be 20,000 people that will be trained with the specific information that will assist people with the website and the service centers, and work to give them the information that your poll suggests they don't have. And then the third, of course, will be the broadcast messages, and they will roll out in just another few weeks. I think we're going to give a little preview at the Covered California meeting this Thursday, and then a rollout next week and around Labor Day, and again with a build to that October 1 launch. And this will be a rolling process really over 2 or 3 years. You know, we've all focused on October 1 as the day, but that is really getting to the starting line. October 1 begins this process of enrolling people over a period of time and then providing service to them over 2014, 15. So I think the data that you've collected is really valuable to us and to the people that will need these services. I was particularly struck with the data about what we call young invincibles and their lack of information. And just a little preview to some of the work that we're doing. Much of our campaign will be targeted to moms. We know that women make healthcare decisions, and it's the moms that worry about their 20-somethings without health insurance that they can't keep on their plan anymore after 26. So the 28 and 29-year-olds might not know about Covered California, but their moms are going to know about it. So just as we're reaching out to trusted people throughout the communities, we've done some very sophisticated work about who the decision makers are. And so I'm very delighted with your data, Mark, and very appreciative to the Wellness Foundation for the work that you've done to create this body of information that has positioned us to be ready to launch, and that will help guide us over the next 2 or 3 years as we make this successful and improve lives for Californians.
Thank you very much, Secretary Dooley. Ellen? Yeah,
Hi, Ellen Wu, California Pan-Ethnic Health Network. This is, I keep saying this in all the forums, it's really exciting because CPHEN was founded in 1992 in the era of healthcare reform. And so many of our founding members are excited that we're going to see it come to fruition very soon, and really want to thank the California Wellness Foundation in support of CPHEN and these efforts, and especially for funding the oversampling of the Asian American respondents in language. Appreciate that. And I also want to thank our state policy leaders for fighting for the full expansion of Medi-Cal, especially for recent legal immigrants, and improving the mental health and substance use services benefits in Medi-Cal program. We're, for over 50 years, childless adults have been left out, low-income childless adults have been left out of the Medi-Cal program. And January 1st is a huge day of opportunity for this population that have been left out of the system. So the field poll found that in general, over 65% of the respondents from communities of color support the ACA. I think in part that reflects the fact that these are the communities that will benefit the most from the ACA. Over 4 million Californians who are eligible for subsidies in Covered California or Medi-Cal expansion, of those, 2.8 million or 67% are from communities of color. While the field poll continues to indicate that increased awareness is needed, there is good news that there's high interest to learn more, particularly among communities of color. So we need to capitalize on this, like the Secretary said, by partnering with trusted sources, making sure that outreach workers are trained and have culturally and linguistically appropriate materials to use, and that the information is easy to understand. We know that our healthcare system is very complicated, and can be difficult to navigate. And we need to make sure that these trusted sources and folks on the ground really have a basic understanding of how to help them not only enroll, but once enrolled, use the services that they now can access. So the $37 million in outreach and education grants from Covered California to the community organizations are really, really critical to the success, and we look forward to hearing about the training and seeing it roll out. And we're hoping to see soon the $53 million from the Department of Healthcare Services go out to the counties and the community organizations to start Medi-Cal outreach also. I think all of us feel that there was no surprise that there was a strong preference among non-English speakers to receive information in their own language. Makes sense that you want information that you understand. Of the 4 million who are eligible for Covered California and Medi-Cal, 37% will speak English less than very well. So this is a large percentage of 1.5 million Californians who are targeted for this newly eligible. What is the state doing about that? Really great things. Both Covered California and Medi-Cal are translating their materials in 11 different languages. We are hoping that eventually the online application, the portal for application, will be translated into additional languages besides Spanish. I think it's really important that we think about having dedicated 800 numbers for each of the languages. Because even with the translated information, if people see the same 800 number being used, they will not trust or believe that when they call that number, they will get someone that they can speak to. So it would be great to look into that idea. Communities of color overwhelmingly feel that Medi-Cal is important for their families, and it's been successful. That's really good news, and we anticipate that in future poll years we will continue to see this upward trend in positive feelings about Medi-Cal, especially as we implement the new streamlined eligibility process. The modified adjusted gross income makes it much easier to understand whether or not you qualify for Medi-Cal, the elimination of the asset test, and the simplified redetermination process. We also need our online application to connect as soon as possible to the federal data hub so that people will no longer have to present their paper proof of residency and income. So the sooner we do that, the more automated and electronic and paperless we'll be able to go. The state's already done a lot of work in meeting the needs of communities of color, but there is more to do. So we hope to see the Medi-Cal outreach start soon, and translating the online application into Chinese, our CalHEAR system, and the establishment of 800 numbers dedicated for non-English languages, and then connection to the data hub. So in closing, I want to say that I'm always awed by the really, really smart and committed people in California, and just really proud and honored to be a part of the implementation efforts in a state that is leading the country in this, and that is really committed to meeting the needs of communities of color, including non-English speakers and immigrants, to have affordable health coverage.
Thank you, Ellen. David?
Thank you. Let's see how closely I have to speak into this. No, it works. The thing that struck me from the poll was that people get it. I mean, even after the most vitriolic partisan debate that we've had in a long time on a complex issue, people really understand it. And I think part of that reflects California's approach. I'm just sort of curious. I mean, Mark DiCamillo mentioned Governor Schwarzenegger and his effort to do health reform. There was another Republican governor. Anyone remember? Does anyone remember Earl Warren? They named a road after him somewhere. Anyway, and that was 55 years ago, and that was not successful. But when we had the Medicare debate 50 years ago, you know, enormously controversial, and it is our hope that 50 years from now, when we'll have another panel just like this, and we'll all be on it, we will look back and say, you know, what was all the fuss about? One of the things that the poll, that the research findings indicated, reinforced our sense that how personal healthcare is. I mean, people get it because it's based on their personal experiences, and everyone in this room, and I recognize many of you, are aware of how personal the decisions that people make on healthcare are. And when we talk about people who don't have insurance, let's just sort of remind ourselves why they don't have it. Because they all, I mean, sometimes we forget in the policy discussion. In most cases, they have pre-existing conditions, so they're not able to get it. If their employers don't offer it, it makes it very difficult and challenging to pay for it. And then fundamentally, it's expensive. Healthcare is very expensive, and for most people who are uninsured, it's simply unaffordable. We know, and I think that the research also reinforces our sense that when you ask people about it, that reflecting on these personal experiences, the fears that they have, the concerns about going bankrupt, that when offered a chance to buy it, that they are not only interested, but our research shows that they will buy it. I think everyone here has stories of people who have been unable to get insurance for any number of reasons. I mean, this is sort of brought home to me just as a personal issue. A friend I went to school with, independent consultant in the Bay Area, never was offered health insurance. My age, develops a condition in his leg, never goes to the doctor, and basically drops over in Safeway in Oakland, and rushed to the emergency room and passes away. You know, every one of us knows people that are just like that, and people who don't have insurance also are aware that it's just by the grace of God that they might face the same fate. And for those that are parents and have children who may have coverage, those concerns are even more real, because they're, you know, the parents, as the secretary said, families care about the health of family members. We have an enormous challenge in terms of implementation. The good news is that in California, we are in many ways an exception. Because of a very broad political base of support that was reflected in the survey, I think that it's made it much easier to build a political consensus for health reform in California. And you know, when you look at some of the fights that are going on in other states, we haven't had that problem here. California was the first state to pass legislation creating the health benefit exchange right after the passage of the Affordable Care Act. There was strong support from the prior administration. There's been tremendous support from the current administration. I want to thank the chair of our board. It's always good to say nice things about the chair of our board, Diana Dooley. But you know, the current administration has been more than just a standby player in this. They have been a partner in making this work, and again, it's a difference that other states do not have the benefit of. Having said that, though, we do have an enormous challenge in terms of our timeline. In less than 6 weeks, October 1st rolls around, and that begins our open enrollment period. And as the secretary said, it's not we don't expect all million of our potential enrollees to sign up on that day. Health insurance is complicated, and I think the poll actually, as additional research is being done on this, I think you're going to find that the choices that consumers are going to have to make are complex. And it's going to take them, and the costs are, if you're not talking about Medi-Cal, in the case of covered California products, although they are much more affordable because of the federal subsidies that are available, people are still going to have to pay, in many cases, significant amounts of discretionary income that they're not spending now. We think that that at the end of the day that they're going to make those choices because their mothers are going to tell them that they have to, just like all other things. There are, coverage begins January 1st. That's really the most important date to recognize. And we are building towards that so that, that everything is in place to take advantage of that. There are 3 elements that we believe are critical to our success. The first is you have to have something that consumers want to buy. And so the affordable health plans that we've used our purchasing power to negotiate good rates for is sort of the first pillar of the structure that we're building. The second is, and I think this was also reflected in the survey, is that we have an enormous education and outreach task ahead of us. In order for people to make these decisions, they're going to have to understand what their choices are, what their responsibilities are, and how it works, what the mechanics are. And so we are putting together not just an advertising effort, but we're engaging people on the ground who can help on a one-to-one basis in a culturally sensitive way and in the communities and with people that our consumers trust, an infrastructure that can provide that one-on-one assistance, both insurance agents, we're calling them now certified counselors who will be out in the communities doing this work. And then the third piece is smooth enrollment. We are now working on, as many of you know, our eligibility enrollment and retention system, CalHERS, which will provide for the first time a single streamlined application both for Medi-Cal and for covered California products. And it will be an online portal it won't be, our executive director used to say that it's going to be, he used to say this anyway, we would hope that it would be as easy as Amazon. He's now saying, well, maybe it will be as easy as TurboTax. For the first couple of years, I mean, we know that this is not going to be a simple thing because health insurance isn't simple. But on the other hand, as the poll indicates, this is something that in California people are very interested in learning more about, getting more information. For those that don't have insurance, for those that are low income, even more so. So let me just again thank the Wellness Foundation for sponsoring this, the DiCamillo for doing the work, our chair, and just so that almost everyone on the panel here has a institutional role with Covered California. Ellen Wu is the chair of our Plan Management Advisory Committee, and we're working on it still. And so anyway, thank you very much.
Thanks, David. Thanks, David. I'm just going to say a few words of my own before we jump into the questions. And thank you for the other panelists for your thoughts. I'm going to try to build on some of the things you said today. As Mark said, this is perhaps the most stable multi-year polling that he's ever done on a political policy question. It basically has not budged since the law was passed in 2010. And I'm going to go out on a limb here and make a prediction that if we are back here a year from now, it will change. And it's either going to go down or it's going to go up. And if you held a gun to my head, I actually think that support for the law is going to go up in the next 12 months. And I'll tell you why. First of all, just to review, you could think about this law as 3 major parts. There are hundreds of parts within it, but I always think of it as really 3 major things. The Medi-Cal expansion, the insurance regulation, and the Covered California, the tax credits, the mandates, the piece for the individual insurance market. So let's think about each of those things. The Medi-Cal expansion is actually already somewhat popular. And what's not to like about that for California voters? There might be a shortage of primary care physicians. There might be some some difficulty in the newly eligible getting all the benefits they want or need. But I think it's almost rock solid that the situation for those currently uninsured people is going to improve over the next year, even if it's not 100% what the designers of this plan had hoped for. And then beyond that, for the people who are not directly affected by it, there probably will be some marginally improved perception that almost the entire Medi-Cal expansion is being paid for by the federal government. And so I think the last numbers I saw, when that is fully implemented, Californians are going to be getting somewhere in the neighborhood of $6 billion in additional health care for that population at a direct cost to California taxpayers of about $600 million or less. So I think that's certainly not going to get any less popular than it is now, and overall I think it's going to probably be more popular than it is. Second, the insurance regulation. Already, if you poll the individual pieces of that part of the package, they are broadly popular, and I think they'll even be more so a year from now. Once we have a guaranteed issue, once people understand that they cannot be denied insurance because of a pre-existing condition or lose their coverage because they get sick or injured, that's never going to be taken away. Even the Republicans in Congress, I think even Mitt Romney last year when he was running for president and sort of half-heartedly calling for the repeal of the ACA, have said that they don't want to repeal that provision. And so, that's really the heart of the insurance regulation piece, and it's going to be very, very popular. Other parts of it that are already in place that people, many people don't know about, the phase out of the caps on benefits. It used to be if you or someone in your family had a very serious illness and ran up hundreds of thousands of dollars in medical bills, just when you needed your coverage most, you were prone to losing it because of these annual or lifetime caps on benefits. That's no longer the case, and once people understand that, I think that's going to be very popular. Already, letting your kids, adult children, stay on your plan until age 26 is very popular already, and is only going to be more so. Things like getting preventive care without any out-of-pocket costs. There's a whole list of new regulations on the insurance industry which are going to be very popular with voters once they start to sink in and people get a better understanding of how those things are affecting their lives. And then the third piece is the one we've talked most about here today, and that's the individual market in covered California and the subsidies. It's probably also the most problematic. I should say that the one caveat on my prediction is the technical side of this. If David and the Secretary flip their switch on October 1st and this thing blows up, that's not really on the ACA as far as I'm concerned. It's on them and their agency and their ability to write a computer program that works. So that's kind of in a separate category. Clearly, if it logistically and technically doesn't work for people, if they're not able to go online and buy the coverage they need, that's going to be a big problem, not only for those individuals, but in public perception. Even people who are not in that market, if they read on my website or in the LA Times or the Sacramento Bee that there's a major snafu or worse with the online interface and the way that program works, that's going to just give the whole thing a black eye, and it'll take a long time, I think, for people to come back around to, that this is a good program. But let's be optimistic and assume that the $700 or $800 or $900 million you guys are spending on that piece, only 400, I thought it was more than that. $400 million will be money well spent, and that when they go online with the system, it will work. Then the question is, well, what about the actual programmatic part of this? Did you say you're expecting 1 million customers in the exchange? What is the population, about 3 million potential?
About 5 million we think would benefit. includes people, that includes.
That's includes.
That includes, no, that's, there are about 5 million that are in the individual and small group markets, and those that are